12 is tracking the COVID-19 vaccine, and today we're learning more about who may be next to get it in Oregon.
We wanted to get an update on that after the state's Vaccine Advisory Committee met today to make recommendations. Fox 12's Brenna Kelly joins us now live with what they talked about today and what comes next. Brenna.
Well, this is the committee's second official meeting. Others have been optional. It lasted 2 hours and, similar to others, went off course repeatedly. It wasn't until the last 30 minutes when members began to discuss specific recommendations.
Oregon's Vaccine Advisory Committee agreed to move forward with this new list of groups to receive the shot next. It's not in order of priority. Establishing BIPOC communities high on the list, including Black, African American, Hispanic, Latino, Indigenous, Pacific Islander, tribal and urban-based natives, was important for several members.
BIPOC people were prioritized for testing. So I don't understand why they cannot be prioritized for vaccines. They were explicitly prioritized for testing based on the data. So to not extend that to vaccines does not make sense. It is not evidence-based. It is not based on the data.
Also included on the list are refugees, adults with chronic conditions, people in custody, other frontline workers, people living in multi-generational homes, and low-income senior housing and other congregate senior housing for people younger than 65. But these specific recommendations weren't considered until the last 30 minutes of the meeting. Concerning some VAC members, they'd have to table all the work they'd done.
We're in an urgent situation right now. We need to move forward. And right now, honestly, what I've heard, a lot of white people are getting vaccinated that don't meet our young people, not sick, upperly mobile, and so there's really disparities there.
While others found it hard to vote when they weren't clear what vaccine dose capacity Oregon will have.
How this recommendation could realistically be put in place when there's a vaccine shortage and there's a rule that anybody who identifies as BIPOC is prioritized. I might be missing something, but I am not understanding how that is practical. How are people going to prove that they're a member of the community?
Yeah, and these groups are recommended for Phase 1B. That's alongside educators and also people over 65. It appears the decision will ultimately be up to the OHA. Reporting live in Portland tonight, Brenna Kelly, Fox 12 Oregon.